OsteoStrong looks impressive, and for many people, their bone density numbers even go up. But here's the problem. Better bone scores do not automatically mean a lower fracture risk. I've seen people with the same bone density, and yet one breaks a hip, the other one never does. Why might that happen? That's part of what we'll talk about today. Here's what you expect to learn. First, we'll discuss what is OsteoStrong? Does it actually work? Can you build muscle using OsteoStrong? Is OsteoStrong safe for seniors? As well, how does it compare to the existing gold standard, which is strength training? Is it superior to strength training, inferior to, or as good as? And lastly, is OsteoStrong really worth it? Before we jump in, who am I? My name is Igor. I'm the author of the Amazon best-selling book, Osteoporosis Reversal Secrets. There are two books with the same title, a first edition and a second edition. As well, I run an online personal training company that specializes in osteoporosis reversal. And just so you don't think I'm some random guy on the internet with an opinion, I'm actually a personal trainer who trains clients with osteoporosis, like Darlene, who had breast cancer, and as a result of estrogen-reducing medications, developed osteoporosis, and we were able to turn that around. Laura, age 68 in this picture, she had a long family history of osteoporosis, and we were able to improve her bone density scores as well. And Anne, who was an accountant, 60 years old here, ate reasonably well, exercised, and despite that, developed osteoporosis, and we were able to improve that as well. So let's jump in. Who am I? What is OsteoStrong? OsteoStrong is both a gym and a method. It's a gym with specialized equipment as well as a method. So what is the method? The method is you use pretty standard gym equipment, but the setting is so that the weight is high enough that it's immovable. So you push with as much force as possible and the weight will never budge. So you're using isometric or static contractions. The question is, does this actually work? Let's look what the research has to say. Here's one study titled Brief, Low Impact, High Intensity Osteogenic Loading in Postmenopausal Women. So in this study, 147 postmenopausal women with osteoporosis were divided into four groups. Group number one did OsteoStrong but didn't take medications. Group number two did OsteoStrong and they took medications. Group three did not do OsteoStrong and did not take medications. And group four did not do OsteoStrong and they did take medications. Here is what happened after a year. The group that did OsteoStrong and didn't take meds, they improved their bone density by 1.1%. As far as is that good, is that bad? First of all, it's definitely better to improve than to decline or to even hold steady. So that's good. But does that result in a marked reduction in fracture risk? Unfortunately, a 1% improvement in bone density does not reduce fracture risk very much, just a tiny little bit. Those who did OsteoStrong and took medications, they improved 4.2%. Those who did not do OsteoStrong but also didn't take medications, no surprisingly, they dropped 1.6%, and those who only took medications with no OsteoStrong improved by 1.0%. So to continue of whether or not it actually works, here's another study titled Brief, Low Impact, High Intensity Osteogenic Loading Training utilizing proprietary OsteoStrong devices with once a week 10-minute treatments improves bone mineral density in women with osteoporosis of the lumbar spine. So this is a mouthful, but let's explore what this study did. They recruited 140 postmenopausal women with osteoporosis and divided them into two groups. Group number one did OsteoStrong. Group number two did no exercise. So it's not a comparison of OsteoStrong to medications or strength training, just OsteoStrong versus no OsteoStrong or any exercise. So after 9 months, the OsteoStrong group, their lower backbone has improved by 2.2%. Their T-score went up from minus 2.27 to minus 1.93. So that's actually a pretty good result. Group number two, I had no changes, which is not really surprising. So does OsteoStrong actually work? Let's continue. Here's a third study. And basically what it's saying is, yes, it does improve bone density, but the real question is, does it improve fractures? And that question is not answered in any research. So the next question is, does OsteoStrong help build muscle? The answer is a very definitive, decisive no. Why not? Because to build muscle, you need two things. One, you need strength training. OsteoStrong is not strength training. The other thing you need is adequate protein. OsteoStrong is just an exercise method, kind of, but not a nutritional method. Let's compare the optimum muscle building protocol to OsteoStrong. For building muscle, you need to exercise one muscle group 2 to 4 times per week. OsteoStrong, the crux of it, is it's only once a week. The number of sets per exercise needed for muscle growth is between 6 to 10 sets for beginners and younger people, and 8 to 12 sets per muscle group for older individuals. OsteoStrong, 1 set, and that's it. The number of repetitions necessary to build muscle is 5 to 30. With OsteoStrong, you do one rep, one long contraction, 10, 15 seconds, and you're done. The type of contraction for building muscle is dynamic. OsteoStrong, by contrast, is static. And in other words, as you can see, OsteoStrong has almost nothing in common with what it takes to build muscle, because it's not a muscle building method. It is a bone strengthening method, although whether it actually strengthens bones or not is still up for debate. Improves bone density? Yes. Improves bone strength? Unknown. So is OsteoStrong better than strength training? No. At this point in time, I think it's actually inferior to strength training. Is it better than walking or stretching or yoga? I think it's actually superior to that. So it's not like good or bad. It's not like better than or worse than. It's where on the continuum is it? At the bottom is not doing nothing. Sorry, doing nothing. Slightly above that is walking and yoga. Slightly above that is OsteoStrong, and the best is regular strength training. Can you lose weight with OsteoStrong? Also, a very, very decisive no. Why? Because the whole crux of OsteoStrong is it's not a workout. You don't get out of breath. You don't sweat. It's literally 10 to 15 minutes, and you do 10 to 15-second contractions. You don't have to change clothes because you're not going to get sweaty. So no, you cannot lose weight with OsteoStrong unless you also modify your nutrition, in which case OsteoStrong had nothing to do with the weight loss. How long does it take for OsteoStrong to work? Largely, bone density scans are done every year, so you would, even if it works sooner than that, you wouldn't know it. Only in research studies is it done any more frequently than that. But even then, it's not done even more frequently than once every 6 months. So it might take somewhere between 6 months to a year to work. The next question is OsteoStrong a hoax? So there is some controversy with OsteoStrong, but is it a hoax? It is most definitely not a hoax. A hoax would mean that the people who are promoting and are selling OsteoStrong know that it doesn't work and sell it anyway. That's not the case. We actually have some decent research showing that there's preliminary evidence that it works. Is it as conclusive as strength training? No, it's not there yet. But is it a hoax? Definitely not. And so, what is the controversy with OsteoStrong? First of all, there are potential conflicts of interest. The people funding these studies are actually giving the OsteoStrong equipment to those studies, to those researchers. That does not immediately invalidate the conclusions of those studies. We just have to know who's providing the materials. It could still be a valid conclusion. We just don't know yet. There are other controversies with OsteoStrong. One is that it does have its share of legal battles, but everything does. This is not unique to OsteoStrong. If enough people take you up on an activity, everything will have legal battles. There are also some reports of people getting injured, and that's why some people say it's a hoax. In my opinion, this is not at all a hoax. You get enough people to do anything, somebody will get injured. You get enough people just walking gently, somebody will get injured if 100,000 of them do it. You get anybody strength training. If you know 10 or 100,000 people do strength training, one of them will get injured for some reason. You can't avoid injuries. You can just do your best to minimize injuries. So I don't think for those reasons that OsteoStrong is a hoax. It's a legitimate method, although preliminary and at this point not yet proven. The next question is it safe for seniors? And the answer is, fortunately, it's very, very safe. Why is it safe for seniors? For a bunch of reasons. The contractions are static. You're literally not moving. You're just pushing against an immovable object. The other thing is fatigue really increases the risk of injury. With OsteoStrong, you don't fatigue because the contractions are only 10 to 15 seconds long, and the entire workout, if you can call it that, or session, is 10 to 15 minutes long. So because there's no fatigue, that really, really reduces the risk of injuries even more. The contractions don't happen to be in dangerous ranges of motion. So because of that, it is most definitely safe for seniors, but not all seniors. This is not safe for people with high blood pressure or heart issues. They should look for other methods of improving their bone strength and bone density. Now, if you want to make it even safer than it already is, here's my advice. As it stands right now, what OsteoStrong promotes is one strong static contraction. I would agree with that with a small modification, and that is this. You do your first set not at your full force. Do it at only 40-50% force. Rest 30 seconds to a minute, and then do a second contraction at 60 to 70% force. Do a third contraction at 80 to 90% force, And only your fourth contraction should be an all-out contraction. So yes, this is going to lengthen your workouts by a little bit. Might take it from 10, 15 minutes up to 25 to 30 minutes. But as safe as it already is, this makes it even safer. Now let's compare OsteoStrong versus the gold standard of strength training. What is better? From a purely research perspective, there are so much more research on strength training, as well as the relationship between the improvements in bone density and fracture risk. What we don't know yet is the improvements between bone density and fracture risk for OsteoStrong. We know that with strength training, bone density can improve by 1 to 4%. And there's a well-established relationship between that improvement and the reduction in fracture risk. We know from lots of studies that a 1% improvement in bone density results in an 8% reduction in fracture risk. So why do I differentiate between bone density and fracture risk? Because bone density is one component of fracture risk, but there are 4 other components. So it's not the only component. So here's an example. There's a medication called denosumab, and here is a review from that. In that review, basically it's Prolia, the risk of fractures at the spine, dropped 68%, and at the hip dropped by 40%. Okay, so again, why do they make the distinction between bone density and fracture risk? Because alendronate, which is Fosamax, also has an associated risk fracture risk reduction. In the spine, it reduces by 45%, in the hip by 40%. However, strength training has reductions on as good as or better than some medications. Strength training alone reduces fracture risk by about 63.8%, and yet it doesn't improve bone density by the same amount as medications. So although there's a lower increase in bone density, there is an equivalent reduction, or sometimes even better, in fracture risk, because medications just strengthen bones. They do not strengthen muscles or address the other components of fracture risk. Strength training, of course, strengthens bones, but it also strengthens muscles, very obviously, and it also improves a few other factors necessary for fracture risk beyond just bone density. The next question is, how much does OsteoStrong cost? There aren't very many OsteoStrong facilities in the world, but those that do exist in the United States, they range from $149 to $249 per month. In the UK, they range from 145 pounds to 295 pounds per month. In Canada, there are so few facilities that it's unknown, and the same thing is true for Australia. So what are the benefits and drawbacks of OsteoStrong? There are a few. The huge advantage is that it's fast. It's 10 to 15-minute sessions. The preliminary research is promising, even if there are some conflicts of interest. It is very, very safe, probably safer than strength training because for all the reasons mentioned earlier. And it's very easy to learn. There's no learning curve. There's literally no motion. You push against an immovable machine. It's hard to mess it up. There are also drawbacks. One is it's not individualized. As I always say in my books and my other videos, is that the bones with the lowest T-scores need the most exercises. But this is a generic program. It's not individualized to any person. Also, again, it has very limited research. At the time of this recording, there are only about 3 or 4 studies. Strength training has dozens of studies, so it's far from proven, and the studies that do exist, a couple of them have conflicts of interest, and one has no conflict of interest. The other drawback is accessibility. There are not very many OsteoStrong gyms in the entire world. And another drawback is that it does have higher membership prices than regular gyms. So is it really worth it? My opinion, I don't think it's worth it. Because you can go to a regular gym and set the machines to a weight that you can't move, and you're going to get the same benefit as an OsteoStrong gym. So there are lots of things you can do. You can do OsteoStrong, you could do strength training, or you could literally do nothing. So again, is OsteoStrong the best thing you can do for your bones? My opinion, probably not. Is it better than lying on the beach on your couch doing nothing? Yes. Is it better than walking? Yes. Is it better than yoga? Yes. Is it better than strength training? No. Strength training is, as it stands at this time, the gold standard for reductions in fracture risk. If you want to dive much deeper into this, I've recorded a very special video called the Stronger Bones Checklist, 6 steps to improve bone density naturally. This video is not available on YouTube, but it is available at this link on your screen right now or in the description below.